Thank you. I come from a French-speaking country, but I will try to speak English. I would like to thank the President of the Congress and all the staff. Benin is a small country close to Nigeria, and our priority of disease is malaria, AIDS, and tuberculosis, and we have to reduce mother and child mortality. In this context, we decide to have universal health coverage, and I am here to present the first step of this social reform. This is the plan. In what context we decide to have health coverage? In our Constitution, the state needs to have effective welfare for all the citizens. But now we have 42% of national health spending who are supported by the population. Just 20% of the population is covered by existing mechanisms of social welfare. So we have no solidarity, no equity, and no efficiency in the health way. It is why we decide to have a global answer for this situation. Our objectives are to contribute to the improvement of financial accessibility of the population to quality health care. We need to reduce in a significant and sustainable way the phenomenon of direct payment of the health care. We need to guarantee to the patient a good quality of health care, and we need to increase in our country solidarity, equity, and efficiency in the health care. We have 7 main principles to characterize our health coverage chain: universality, solidarity, contribution approach, equity, efficiency, general responsibility of the government, self-participation of population. And to succeed, we build attractive package of service, indicative list of medicine, and informatization of data in all the system. Our key results. The National Health Insurance Agency is created in 2012. After 6 months, in 2030, we deliver the third card of the members. We decide to begin with the vulnerable peoples. It is the informal sector, the agriculture sector, and so on. And now we can say that we are around 50,000 people who have started with health assurance in our country. We have a project of law. We send this project to the Parliament. And the National Health Insurance Agency, we are building this National Health Agency. For the funding, it is the government who contributes, and we have some partners like P4H, providing for health, like World Bank, who assists the country. What are our difficulties? In the institutional level, we don't have the law. It is a conflict of interest in the country and in the parliament to have the law. In financing system, we are a poor country, so we have financial weakness of the population to contribute. In social level, we have low foresight culture of the population. We have resistance for change of the actors, and we have cases of abuse on behalf of the actors. But we have some challenges. It is to have the process of adoption of our law in the parliament, the signature of agreements with healthcare to provide health with the health assurance. It is the exchange with actors of the health system. We need elaboration of integrated financial plan, including innovative source of financial health system in our country. And we need to intensify the communication because it is a new product. People don't know what is health assurance, so we need to communicate. We need to have some campaign to the people in essence to increase the membership of population. And we need to progress in detection and correction of possible inadequacy. And we have to strengthen the capacity of building the national assurance with all the actors. It is important to us because we are faced to health funding. We need to have this health assurance. It is not, it is not a joke. It is a priority for all Africa countries. I think that, as you say, in post-2050, it is a priority for Africa country. Thank you.
Thank you very much indeed, and that gave us a very nice overview of certainly the challenges, but also the successes and the potential for a systematic approach to this major issue in your country. Would you like to take some questions?
Yes.
Any questions? Yes, there's a question down there. Do we have a microphone? Oh, okay. I'll just repeat that. So you very nicely documented the growth, but have you actually a time frame in which to implement this change?
We just start to implement, and we visit some country to share experience and to build our system in our country. So we just start. We know that we learn by doing.
Okay. Any other questions? Yes? There's a microphone coming.
Thank you. Hello, yes. Thank you. You know, Jim Kim at the World Bank has made the same pitch that investments in health are one of the most cost-effective returns on investment that a country can make. And he deals with the ministers of finance as opposed to the ministers of health. So my question to you is, have you made any progress with the ministers of health as another venue to shift national priorities towards the health agenda?
You mean ministers of finance?
I'm sorry, ministers of finance to move the agenda towards health investments.
So the World Bank deals a lot with ministers of finance. And has there been any progress made in dealing with ministers of health with respect to the World Bank, or in your context, ministers of finance?
Yes, it is important to work together with Ministers of Finance and with the financing institution. We have World Bank, we have Africa Bank, and some financiers in the country. And we have almost private partnership in our country who supports this initiative.
Okay. All right. Well, thank you very much, Minister, and I think we'll thank you.